When you are retiring, you're going to be making a lot of financial decisions, and you'll probably be getting help maybe from a financial planner or for friends or from the internet. And there's a little known thing that happens whenever you're retiring, and it relates to a tax on your Medicare. And most people don't know about this. Most financial planners don't know about this. So we want to share that with you today. We talked to a lady just a couple of days ago, and she was given some very bad advice that is going to cost her about $6,000 extra just in the year that she retires, and even more next year. And so we're going to talk about how that happens and how you can avoid that. Because if you're starting Medicare, if you're retiring, there can be a lot of unanswered questions, a lot of confusing things. We're so glad you're here with us today. I'm in the studio joined by my dad, Marvin Music. And if you want to be a part of today's show, if you want to call in and get your question answered from truly the nation's leading expert on Medicare, this is your opportunity to talk to him. And so the phone number is down there at the bottom of the screen. It's 833-824-2004, 833-824-2004. Call in if you have a retirement question, a Social Security question, or a Medicare question. We would love to talk to you. So, Dad, talk to us about this tax time bomb, this thing that can happen that most people don't know about as it relates to Medicare.
Well, the issue that we're dealing with around this topic has to do with Medicare Part B and drug plans. We all know that Medicare A has no premium, but everything beyond A is going to have a premium. So when you go on Medicare, your Part B premium is going to be established based upon your what is called modified adjusted gross income. So modified adjusted gross income, very simple. It is your adjusted gross income plus line 2A on your tax return. So let's say we're on Medicare this year. You are 2026. The government looked at your 2024 modified adjusted gross income. And the government establishes thresholds. So there's several thresholds. For today, I'm just going to give you two of them. So if you are a single and you file an individual return, the threshold for you will be $109,000 a year. So we're on Medicare 2026. They look at 2024 modified adjusted gross income. And if you are $109,000 or less, then you do not have this problem we're talking about. If you're married, you file a joint return and you're below $218,000. Again, you do not have this this tax bomb problem. But if we're above 109 or we're above $218,000, then this could apply to you. And so what happens is anything above the thresholds, then you have this additional surcharge called an IRMA. It's an acronym that stands for IRMAA, Income-Related Monthly Adjustment Amount. And just look at it as a separate Medicare tax. And so what oftentimes happens is that as people get ready to retire, they may be doing a Roth conversion, pulling money out of an IRA or 401k and moving over to a Roth. Or maybe you're going to do a big house remodel and you're going to pull out. We've had people, a guy that was going to pay for a very expensive wedding, $50,000 for a wedding, so pulled money out of his IRA. So when you begin to pull money out of your IRAs or 401ks, either it's for a Roth or any other purpose, you have to pay taxes on that. And so that becomes income on your tax return. So if you're on Medicare in 2026 and they're looking back at 2024, it could be possible that you're above those thresholds, then the government is going to charge you this IRMA. Lowest IRMA is about $90 a month. Highest IRMA is about $575 a month. There's actually 5 different levels of IRMA. And so one way that a person could avoid having to pay these additional taxes is if you will do a Roth conversion or pull out for whatever reason 1 year or 2 years before you actually begin Medicare, then you have an appealable offense. You have an appealable life-changing event that says to the government, hey, I retired or I semi-retired, and I don't want you to look back 2 years. I've retired. So let me give you kind of a better example. So if I'm on Medicare in 2026, I know they're looking at 2024, and my income could have been up because of whatever reason. But if I retire in 2026 and go on Medicare, I can tell them, don't look at 2024. I'm going to give you 2026 numbers, and they will look at 2026. And so you can appeal. We do that with a form called an SS-44. And so they don't source where the money came from. As long as you have a qualifying life-changing event, which is normally work stoppage or work reduction, we retired or semi-retired, then we have the ability to give them new numbers, right? And so that's when you can take advantage of not having to pay these IRMAs if you timed them correctly. So my advice is this: if you know you're getting ready to retire, let's say you're going to retire in 2027, if you do a Roth conversion, pull out money of the IRA in 25 or 26, you retire in 27, you have an appealable offense, and you can get those IRMAs reduced.
So you need to do it. There's almost like this 2-year forgiveness period, for lack of a better term. It's not really forgiveness, but it just allows you to use that life-changing event of retirement, which is the most common.
Right.
And then get that IRMA appealed. So the biggest ways we see, people get charged this tax, this IRMA, is just from income. That's probably the biggest thing, right? Oh, I made above the threshold. So you're going to need to appeal it if you retired, right? And then that you'll probably win it.
Yeah, and if your income was affected by your retirement, meaning it went down, you will win the appeal.
Yeah, exactly. So then if you're working with a financial planner, and part of that strategy is, hey, we're going to pull money out of one of two things: either pull money out of an IRA, or take IRA into a Roth conversion, meaning you're taking it from a pre-tax account, you're paying tax, and going to put it in this thing that
treating
goes
as income.
Deferred. Yeah. Either way, whether it's a distribution or a withdrawal from an IRA or a Roth conversion, it's going to be treated as income. And so if that's part of your strategy, you need to do that around that time when you're going to be retiring as well.
1 or 2 years before.
1 or 2 years before.
Exactly right, because they're going to look back too, and I can give them current numbers.
How about selling a house?
Okay. Well, when you sell a house, first
I was reading a story yesterday about somebody who bought a house in 1996 for $67,000. They just sold it for $1.2 million, right? That's maybe they put a little bit of money in it. So let's say maybe their basis was $200,000. That's still $1 million of equity gain. How does that work into all this?
Yeah, what happens that, as long as they lived in that home 2 of the last 5 years and owned it, then they can exclude, a single person can exclude up to $250,000 of profit. A married couple filing a joint return can exclude up to $500,000. But anything above those exclusion limits then will still be treated as capital gains.
Does that come into the IRMA calculation?
Absolutely, it does.
So let's say this person had $1 million worth of equity.
Capital gain.
They're able, capital gain.
Yep.
They're able to exclude $500 because let's say they were married,
right?
And so they've got an additional $500 that's going to go on their income in that year. Now, if they do that in the year that they are retiring,
1 or 2 years before, that's right.
They can appeal
use
it.
The excuse
because the Social Security doesn't care where the money comes from.
They don't source it.
They just care that you had a life-changing event.
Exactly
so if you coordinate all that, boom, you're fine. You can appeal it, get that IRMA tax dropped off. But if you don't, right, and you just continue working, or maybe you retired 5 years ago, and now you go ahead and sell that house, that's going to be counted as income.
That's exactly right.
And there's not anything you can do about it.
That's right. It has to, any of those events that we get to use that would be financial, as long as it happened 1 or 2 years prior to our life-changing event, then we have an appealable offense.
Okay, so let's fast forward the clock a little bit. So there's a lot of things, there's something that a lot of people don't realize, and there's this topic called required minimum distributions. And that's basically where the government says, hey, you've been saving money in your 401k, you've been saving money in your IRA, your 457, your TSP, whatever it is that is in a tax-deferred account, meaning you put in the money, you haven't paid taxes yet, and the government says, hey, great, you did this for a long time, we need some tax revenue off that.
Right.
So at 73, they force you to start taking money out of those accounts. And it starts around 4%. So if you had $1 million in that, you're at $40,000 that you have to take out.
Whether you need it or not.
Yeah. So if you have Social Security and a pension and an additional $40,000, that's going to push a lot of people over that limit. So between now and then, part of your planning can be, and we can help you with this. We have a financial planning team here at MedicareSchool.com that can help you. we've been doing that for 15 years. You can do some planning now to say, okay, what if we pull some of that money out for the next 6-7 years between 65 and 73 and get some of that money out to the point where whenever we hit 73, there's not so much money in there that we get pushed into IRMA land.
Exactly.
Right? So you can kind of look at this as the retirement thing that's happening now, but if you have sizable amounts of money in the tax-deferred account, you need to start thinking about that now. Are there steps you can be making? Because no one wants to get into 73 and realize that, oh, my Part B premium went from $202.90 up to $400. Like, that's just, all because the government's forcing you to take money out of your accounts.
Right. So anything that we would do 1 or 2 years prior, they will not hold against us if indeed we have that life-changing event.
But in the future,
that's right.
Or if you retired 5 years ago and you sell your house now or do a Roth conversion now, you're kind of out of luck. Let's get to a caller. We've got Greg in Pennsylvania. Greg, welcome to Medicare School Daily. What is your question, sir?
Yes, it's kind of confusing, so bear with me.
Okay.
I had a PET scan done earlier this year, and I had a doctor send me a bill for $21.55, and the hospital sent me a bill for $283. I already paid the $21.55 because that bill came about 2 months before the hospital bill.
Okay.
Having a supplement plan, I don't know what the $21.55 is for.
Do you have a Plan G?
Plan N in Pennsylvania.
Okay.
Okay, so well, the 283, that's this year's deductible, so that sounds very accurate. So what I would do to correct the problem is this. I would call the insurance company. Who is your insurance provider, Greg?
Humana.
Humana. Okay, so you have a supplemental plan with them?
Yes.
Okay, very good. So I would call the Humana customer service department because they will keep very precise, accurate records, and you can tell them what happened. So probably what you probably should not have done is paid that maybe that $21.55. But it could have been the very first bill that came through, so that's what they processed. So I'm assuming that what happened was they that must have been 20% of whatever that particular visit was billed at. That's my guess. But listen, to have no questions, call Humana, and they will tell you exactly what to do. And it could be that you'll get a refund from someone. I think that's what'll happen.
Assuming you had not already paid your Part B deductible earlier in the year, is that correct?
Correct. I know that the bill from the hospital, $283. Well, I called the Humana, and they agreed with me with what you're saying that the $21.55 should be applied to the deductible.
Right.
So I should only owe the hospital the difference. But when I called the doctor that charged me the $21.55, he says that's his copay for reading he's the one that interpreted the PET scan.
Okay.
And I'm thinking, if that's the copay, then why did he charge me $21.55? He should only be charging me $20, correct?
Yeah. Well, the truth is, you're not even eligible. I mean, you're not even required to pay him anything because the copays are for when you actually see someone. That's a primary care doctor. That's a specialist. That's when those copays come into existence that cannot exceed $20. So he should have been paid entirely the 20% coinsurance by the plan, by Humana. So that's how that should have happened. Yeah, there's only like 15 codes that a copay actually applies, but it's when you actually see someone face to face. So if he read it, that should have been covered by coinsurance.
Well, I also called the hospital about the $283, and they told me that's my deductible, and I told them I already paid $21.55 towards that. And they said that doesn't matter. You still owe us the deductible. What the doctor charged you is his copay.
Yeah. Okay.
There's no chance there would have been a doctor copay involved in that.
No, because he didn't see that doctor. So
you never met with this doctor?
No.
No.
He,
Now, I could
apparently
see.
he just interpreted.
Yeah.
Yeah.
I could see how that would anything that doctor did
Yeah.
could be applied to the deductible, but it would have been more than $21.55.
Right.
So I'm just saying you should not owe a copay for that service. However, Greg, here's what you're going to have to decide. My view is I would fight it if I were you a little bit, and then I'd walk away.
Yeah.
Okay, it is not worth the frustration.
Yeah, I mean, you could look at it as though it's a $20 copay and they charge you $1.55 extra.
That's probably the way I would view it. I'm not minimizing, the frustration, because I'd be frustrated if I were you as well. But you start fighting. You start fighting these things, and sometimes you never win it. It's like, hey, go play with your grandkids. Go have a good, go have fun doing something instead of fighting these providers.
Humana did tell me they'd resubmit the bill.
Yep.
And which they did, but the hospital still says no. You owe me $283.
Well, I mean, you're going to have to pay that. You have to pay that $283 deductible anyway.
Yeah.
Correct.
So yeah.
Yeah. Who really owes you the money is that doctor for the $21.55. That's what should happen.
Okay.
So I'm just saying, good luck on that. I feel your pain on it, but yeah, I'm glad it wasn't multiple hundreds. Go ahead.
Here's another question I have. I was told by the hospital that this doctor is non-participating.
Oh.
So is he allowed to charge me an excess fee?
Sure is.
He's non-participating.
Yeah.
Yes, sir. That's exactly right. So that's what that could be, because he can.
Well,
go ahead.
Does it matter if my PCP referred him?
No, it really does not matter. But yeah, so that could be it. What's interesting about that, though, he is a physician. Is that
yes.
Okay? He is. Yeah. So only physicians can add excess. So that really could be it. That's interesting. Yeah.
Because he could charge
I figured in Pennsylvania
15% above the.
Yeah, you should find that out. Ask him push him on the Humana if that's an excess charge.
And you live where?
Non-participating.
Where do you live?
Pennsylvania.
Oh, yeah.
Well, wait, did it happen in Pennsylvania?
Yeah.
Like, does that doctor live in Pennsylvania, or is he across the state line or something?
That I don't know. All I know is I sent the bill to Indiana.
So this is
which I don't know if that's a third party administrator that I sent the bill to or what. I don't know.
Yeah. Well, you think the provider, though, in Pennsylvania shouldn't be able to add excess. Go ahead.
Why couldn't he?
Well, because it's one of the states.
Yeah, that's
it's one of the 8.
Confused.
Indiana still doesn't have excess?
No, Pennsylvania.
I know, but if you go across state line, they can charge excess.
Yeah, but he didn't. He just saying the administrative, the billing department came from out of Indiana.
I wonder if that doctor
Have you talked to them about that? Did you talk to the billing department?
Yes, I did, but they told me I had to call my insurance company.
Yeah. Okay, yeah, you're going to get your
the thing to know is that with the Plan N, most people in Pennsylvania, or a lot of people in Pennsylvania, do choose a Plan N because there's no excess charges. But anytime there's a service performed in another state, they can still charge an excess, and when that happens, you're responsible to pay for that.
But that's not his situation. He went to Pennsylvania.
I know, but maybe the doctor who read it was in Indiana because he paid a bill to Indiana.
Exactly.
Yeah. Well, is my participating hospital allowed to go out of state to get the doctor to read the bill?
I guess they can. I've never heard of it. I just never have heard of that. But that could be this. You got a couple things going on there.
Well, you should sort this out with Humana and then call us back and tell us, because I really think it makes it makes everyone smarter to understand how these little nuanced things work.
Yeah, but this is a new one on me for sure, Greg. So, all right. Anything else, sir?
Well, I'll look at. Like you said, I mean, it's $1.55, but it's not worth, crying.
But I think the lesson could be bigger if there's something with non-participating and then excess charges. Just a good. I mean, you're going to be on Medicare for probably 30 years, or who knows. So it'd be good to know these things.
Well, I was also wondering. I mean, if this is something that just happened, and I got to live with it. How many other people are they doing this to?
Yeah, absolutely. Yeah. Well, do a little research. Let us know. It's very interesting.
I will do that.
But we kind of nerd out over this stuff.
Yeah. Stay in touch, Greg. We'd love to hear how this works out. Wish we could help you.
Well, I've learned a lot just listening to MedicareSchool.com. That's why I question all this stuff.
All right. Well, good. We're glad we've been a help, and now we're ready to learn from you. Let us know what happens.
Thanks. Take care, Greg.
Okay, I will.
Bye-bye.
Thank you very much.
See
Have
you.
a great day.
Yeah, thanks for
Take care.
calling. Mhm.
Bye.
A lot of people that are in these states where they don't, if you live in one of the states, what are the states?
Okay, they are New York, Ohio, Rhode Island, Pennsylvania. I'm going to say Minnesota, Connecticut, and Vermont, I think.
Okay, that sounds right.
Yeah.
So if you're in one of those states, there's not an excess charge that's applicable. And what is an excess charge? An excess charge is if you see a non-participating, meaning the doctor does not take Medicare assignment, and you have which Medicare assignment is just jargon for saying Medicare is going to pay $100 for this. The doctor can participate in that, or the doctor cannot participate in that. Mm-hmm. How many doctors participate in that?
95% at least.
So then there's 5% of doctors that are non-participating, meaning whatever Medicare pays, they say, I'm not going to have this contract. I'm not going to do that. So then what happens is that non-participating provider says, I'm going to accept $95, right?
95%, right.
$95 from Medicare, and the other 15%, they can bill up to 15% directly to you, right? Directly to the person receiving care. And so if you're in one of those states that doesn't allow doctors to charge excess, that extra 15%, a lot of people will go with a plan N, right? Because they think, hey, my state doesn't allow excess charges, so I'm going to get a Medicare supplement plan N because the doctor's never going to charge that, right? The reality is that's true for doctors that are in that state. But if you ever cross the state line, a lot of us live in cities where you may get care on both sides of the state line. And if that other state across the state line doesn't have coverage or doesn't have this, no excess charge rule, and you have a plan in, you're still got to pay it. Right. And so I think that's maybe the lesson here.
It is.
Folks.
Excess charges are rare, for sure. But when they occur, you're responsible for it. Exactly right.
Okay, let's talk to John from California. John, welcome to Medicare School Daily. What are your questions, sir?
Yeah, so my question is my uncle's turned 80, and he's not very healthy. His United Healthcare PPO in California canceled his county in January, and he switched to a terrible Advantage provider.
Okay.
It's an HMO versus a PPO.
What carrier?
Because there's not United Healthcare.
Okay, so just switched from a UHC PPO to UHC HMO.
No, he actually they don't even have an HMO.
Oh, what? Oh, I thought you said he got switched to an HMO.
Dropped it.
Oh, okay.
So UHC was his provider. They just dropped it completely.
Yes.
Okay.
So now he's on. Go ahead.
No, you go ahead.
Yeah.
No, so what were you going to ask?
We were just going to ask what carrier is he on, this HMO? What did he get moved? What did he move to?
I have no clue. It's a really small one I've never ever heard of. And it's in a really, it's a really small county, and it's not really well populated. It has a large population, but not a huge population. So can he get out of his plan? Can he go switch over to Plan G or Plan N or HCG without underwriting?
No, he cannot. So I'm assuming he's been in the Advantage system for some time. Would that be correct, John?
That's what I think.
Okay.
At his age, he's not real clear.
Yeah, sure, understand. Okay, so when a plan is dropped, he did have a period of time where he would have had the right to be able to go to a Medicare supplemental plan without underwriting. But has probably lost that right now because he went back into another Advantage plan. So I would say that he's probably on that.
What's his health kind of?
Does he have?
It's pretty bad.
Does he have diabetes? Does he have heart issues? Does he have lungs like COPD problems? Anything like that?
He has diabetes and he has a CPAP and he's had a. Yeah, go ahead.
Okay, that's good. That's probably enough. So is there any chronic plans there?
Yeah, there is.
Okay, there is a type of plan he could move to. This is an election that can be made once a year, so he can move to what we call a chronic special needs plan, and we'd be happy to help him with that, to look at the details. I'm not saying that that's what he needs to do, but I think it is worth exploring to see what his medications are, his doctors, his hospitals, and all that, and then we could see if that would be a good fit for him. So, no, are you his power of attorney, or you're just assisting him because he's a relative?
I'm assisting him because of a relative.
Okay, very good. So what I would recommend doing is, if you can, do a three-way call into our office, and you can ask for an agent, and then an agent can go through all of his meds, his doctors, and we can see if moving to a chronic special needs plan would work. Now, I'm going to explain something to you on this, John. A chronic condition, of course, and diabetes is one of them, and the most common. We would have to eventually, I think they give us, what, Josh, 30 or 60 days. Then we actually have to have that verified. There's a form that the doctor fills out to say, yes, indeed, he has this chronic condition. And then that allows him to stay on that plan. And they're really fairly attractive. But again, I don't know enough about his present plan to tell you a chronic plan would be better, but it's very likely that it could be. And we'd be happy to explore that option if you'd like. What do you think, Josh?
Okay, great.
So the carrier, what you might do, I'm gonna say something slightly different. So there's two carriers in his zip code that offers chronic special needs plan. One is called Alignment. I don't know if you've ever heard of that carrier, and one is called Imperial. And I think with both of those, you have to go directly to the carrier to enroll. So I want to give you their phone numbers. The first step, there's three things. I think the first one is, will he qualify based upon his health conditions? And it sounds like he probably will. Like Alignment has one that's called Alignment Health, Heart, and Diabetes Care. Right? There's three different options here. So can he qualify? The second one is, are the providers that he needs to see covered
in the network?
In the network, right? And then the third step is, between Alignment and Imperial, do you know his medications?
No, I don't at all.
Okay, so you're just going to need to say, okay, here's the meds. Tell me what he's going to have to pay for them. The good news is if he's on a bunch of expensive meds, it doesn't really matter. As long as they're in the formulary, it caps out at $2,100 for the year in terms of his actual out-of-pocket.
He's not on Medicaid by chance, is he, John? Medicaid?
No, he's not.
Okay.
Yeah.
Good.
Nope.
Okay, so I'm going to give you alignments. I'm going to give you two different phone numbers. And then I would call and chat with them. This is going to be the only opportunity he's going to be able to move kind of in the middle of the year.
And let's tell him why. Just because he's beyond what we call the Medicare Advantage OEP. We just finished it at the end of March. He could have moved January 1 to March 31.
Yeah. So you're, about 40 some days or 36 days outside of being able to actually change just into a normal plan. So the only plan he can get is one of these chronic special needs plan, which do work out pretty well. So the phone number for Alignment is, you got your pen ready?
Yeah.
Okay, it's 888-979-2247. Okay, that's the phone number for Alignment. That's probably
979-2247.
888-979-2247. And both of their C-SNP plans, chronic special needs plans, are both 4 stars. So 4 out of 5, that's a very good star rating for a plan. Hardly any plan that ever has a 5-star plan. So I would, both of those look good. The Imperial has a 3.5-star rated plan. So I would probably go to this secondly. I would look at this if the alignment doesn't make sense. And their phone number is 800-838-5914. 800-838-5914.
Yeah, so it all boils down to, are his doctors in the network?
Yeah.
And are his medications covered well by the plan?
And does he qualify for the plan based upon his health conditions?
Right.
Like, you need to ask that.
Yeah.
Probably will, but don't assume.
Yeah, so they're called chronic special needs plans. special needs plans. And so we just use the acronym CSNP, SNP, Chronic Special Needs Plan. And so he could move to one of those, if indeed he's eligible and he likes the plan. Otherwise, he's going to have to stay where he is, and then you can help him move later this year, which would be October 15th through December the 7th.
Yeah, and the reason I'm giving you their direct phone numbers is because we aren't able to represent those two plans. If neither of those work out, call us, because we have the rest of the market that's available. Call us during the annual enrollment period, which would begin October 15th. And then we can say, okay, beyond these chronic special needs plans, is there something that's going to make more sense? Maybe a PPO or something that is a little, just more expansive and will work for them. So I think that's your best plan. How's that sound?
That sounds great.
Yeah.
Okay.
Yeah, these are just
California
regional.
Have any special exceptions?
Do they have any special exceptions for what?
Yeah. For switching for his birthday or anything?
No, because he's not on a Medicare supplement plan already. There is a rule that allows people to switch in California from one supplement plan to the next.
But you got to be on one to
be
switch
on one
to
already.
one.
Yeah.
Right. So, yeah.
Oh, okay.
Yeah. His only opportunity would have been after United Healthcare canceled him. He'd had a chance to go to a Medicare supplemental plan. But sometimes people have the right to move to a supplemental plan, but they don't have the money to be able to afford the premium. So I'm not sure where he stands financially. But again, I think that window's already closed on you.
Well, that was in January that he switched.
You mean?
Does that make a difference?
Well, you mean? They terminated the plan. I'm assuming December 31. Is that correct?
That could be.
Yeah, and then normally what they do is they give you 60 days to move to a supplemental plan under a guaranteed issue right. So I'm saying that probably would have ended at the end of February. So anytime an Advantage plan is terminated, then you have a right, guaranteed issue, no underwriting, to return back to original Medicare and get a supplemental plan. Now for him, because of how old he is, he had to get a Plan F. And those can be, kind of pricey. He would not have been able to get a G or an N plan. Okay. So.
Okay.
But this is a viable option. It really is, unless, Alignment or Imperial does not have a plan that is going to take care of his needs. Docs and meds, hospital choices.
Right.
But I think it's well worth the call, John. You're welcome. Glad to be of help. And if they can't help you, just give us a call later this year. We'd be delighted to come alongside him and see if we can improve his situation.
Okay. Well, thank you very much for the advice. I appreciate it.
Nice to talk to you. Appreciate the call.
Thank you. Take care.
Thank you.
Bye-bye.
Bye.
If you are a Facebook user and you like interacting with other folks to learn from their experiences in Medicare and learn from people who aren't just trying to sell you something like a lot of the Medicare experts are in today's world, I want to invite you to pull up your Facebook app and type in Medicare School Community. Medicare School Community is a place that's got, I think, 60,000 people in there. Some are customers of MedicareSchool.com, but many are not. And it allows you to be able to go in there, type in your question, and get answers from real people that are on Medicare. We do have one team member that is in there that's kind of moderating to make sure things don't get out of hand or everything becomes political or people are giving bad information. But this is really a good opportunity for you to talk to other people, connect with other people, get your questions answered about what's really going on out there in the Medicare world. So pull up your Facebook app, type in Medicare School Community, and then you'll see our group. You'll have to answer a couple of questions, and you will be able to join and start interacting with folks right away. Got a question in here we're going to answer from yesterday. Melissa Matthews says, does Medicare cover chiropractic care? I think I read somewhere that it covers an adjustment.
Okay. All right. Well, she is correct. Medicare will cover adjustments of the spine only. And that's it. Other than some chiropractors will do acupuncture. And Medicare does have some acupuncture coverage, I think it's 12 treatments a year. There has to be progress. They have some rules with it, so it's not just across the board. It will cover acupuncture, but they will also sometimes. So when it comes to the adjustment of the spine, it would be 80-20. Medicare is going to pay 80%. Then you as the patient would be responsible for 20%, unless you had, of course, a supplemental plan that would cover that for you. But it's an 80-20 type of a situation. But
So just an adjustment limited. Of the spine?
Yeah.
I don't know what else a chiropractor does.
Well, oftentimes chiropractors could do other types of therapy. They could do traction. They could do x-rays. All that is not then
it's not going to be covered.
Not going to be covered.
Just the adjustment at the chiropractor
Exactly
office.
right. And
everything else is on you.
Exactly right. Yeah. So even if the chiropractor takes Medicare, doesn't mean the services you're going to get at the doc's office will be covered other than the adjustment.
Okay. So how does this differ if you take a supplemental plan, like a Plan G or a Plan N, versus an Advantage plan?
Okay. Yeah. What's going to happen with the Advantage plan is they'll cover adjustments as well. It'll just come with a copay, and normally it's $20 or $30.
Okay.
So you'll pay a copay. Where if you did go to a chiropractor, like I do, I have a G plan, and going to the chiropractor doesn't cost me anything.
Forever, or because
I've met my deductible. Yeah, of course.
If you had a Plan N,
okay, Plan N, you'd have to pay up to a copay of $20.
So a Plan N and an Advantage plan would likely have a very similar out-of-pocket outlay.
Exactly. Yeah, the difference would be though, Josh, if you're on Advantage, you have to make sure that chiropractor's in network.
Not only, it does accept Medicare, but is it in that plan's network?
Exactly right.
Okay.
Yeah, and there are a lot of docs, Medicare, chiropractor that will take Medicare for sure.
Okay. But if you have a Plan G, is there a cap to the amount of visits that Medicare will cover? Like,
nope.
I like chiropractors. I go to a chiropractor, but sometimes chiropractors kind of feel like you're in an annuity to them. Like, you got to come every single day for the next 12 weeks. I mean, it's a lot. So in that sort of a scenario, the best coverage would probably be a Plan G, because once you've met your deductible for the year.
Yeah, I've never read anything where there's a limitation that it, of course, has to be medically necessary. So however often Medicare says it would be allowable for you to go. I've never had a client ever complain about coverage with that at all.
Okay.
Yeah.
That's interesting. Okay. Good question, Melissa. Violet Rose. It's a beautiful name. Probably a fake name. Violet Rose. And she's got a picture of her bird as her profile photo. Says, I recently switched carriers for my Medigap policy. I had a doctor appointment the day before coverage ended on the old one, and then the next one started.
Right.
Does the old insurance company cover doctor charges that occur during their coverage period, or are those charges covered when Medicare has processed them? Good question. Just curious, because I would have met my deductible with the old plan, but not with the new high deductible plan. Wow. Okay. Well, let's just answer the first question.
Okay. Yeah. First off, it's very simple. Date of service.
Date of service. Okay.
Exactly right. So date of service, whoever you had that day is the one that's going to be responsible for that bill.
And then she switched to a high deductible plan. So that's an interesting question. That I've kind of wondered. And maybe this is more of an Advantage plan question, actually. So if you, let's say, because a lot of people will switch during the OEP for Medicare Advantage plans, which runs from January 1st to March 31st. Let's say they did something in the month of March. They switched their Advantage plan from March, in March to start in April. How is the maximum out of pocket calculated? Because let's say they were on a plan for 3 months and had a $4,000 max, and they spent $2,000 of that.
It does not carry over. It does not carry over at all. Yeah, you have to start over when you change those plans for sure, because it's tied to that plan. Now, if someone let's say someone were to move MedSups, then that deductible would still apply because that's a Medicare deductible. And then so it's already been satisfied. But
how does it work with drug? Of course, you wouldn't change drug plans middle of the year.
Yeah, but drug plans would be cumulative if you had you did have the right to change it.
I guess you could if you moved. Well, so let's say somebody moved. Many people moved.
Yep. They'd still be underneath the max out of pocket for the year.
Even with a different carrier?
Yeah, even
so if they were with Humana in Texas and they moved to Florida, and they're with United Healthcare now.
Yeah, I believe it's the total $2,100 would apply across the board.
Because Medicare is like keeping track of that kind of behind the scenes.
Exactly right. Yeah, but the reason the Advantage plan would change because it's just tied to that particular plan.
Hey, if you have a situation like this where you've switched plans middle of the year, we'd love to chat with you because I think it's a great opportunity for you to share and for us to help everyone who listens to us and help all of us get smarter by knowing exactly how some of these deductibles and stuff have carried over in your experience. There's a lot of different insurance carriers. There's a lot of different plans and a lot of different stories and things that we, help people work through. So if you're in that situation where you've changed plans middle of the year, expecting your deductible or maybe your max out of pocket or your cumulative drug expenditure to carry over and it didn't, we'd love to hear about that. It's an opportunity for all of us to learn.
Josh, I've had this happen plenty of times. We've had people that were working and had a cancer diagnosis and underwent treatment while they were still working, but then retired because the cancer is very serious, and then they go on Medicare. And so as soon as their Medicare begins, that Medicare is going to start covering those cancer bills, the treatment bills. A group plan would have been responsible for anything, during that particular date of service. But a lot of people worry about that. Well, I'm amidst a cancer treatment. Can I go on Medicare? Yes. From day one moving forward, Medicare will cover those.
Had an interesting situation. Was talking with someone and they were in the middle of service and service switched over. They were supposed to go have some treatment done, but went to get the treatment and found out it was an Advantage plan, found out that treatment that was scheduled the previous month, they'd been going to see this person, all of a sudden wasn't in network.
Right.
And so now they're showing up the place and the insurance company saying, no, you can't see him.
That's right.
It's just crazy.
Yeah.
That doesn't happen if you're on original Medicare, but it definitely put a big wrinkle and a delay in their whole treatment cycle because then they had to sit around and wait
to find new docs,
find a new doc, get assigned somewhere else, and you're in the middle of treatment. So it's just very, very scary sometimes if you're in the middle of treatment making those plan changes.
Yeah, that's why when you look at something as zero premium on it, there's usually some catch to it, and that would be a network, and there can be difficulties.
If you are confused about your Medicare options, maybe you're on a supplemental plan that's gone up in price, maybe you're on an Advantage plan that you can't see your doctors, or maybe you're brand new to Medicare and you're just learning, you're just starting out, but you need coverage, coverage is going to start in the next month, 2-3 months, whatever it is. That's you. We would love to help you personally. When you call our office, so we not only do a lot of education, we actually have an insurance brokerage. My dad and I have been helping people with Medicare for the last 15 years. We're located in the heart of America in Kansas City. And when you call us to get help with setting up an Advantage plan, setting up a supplemental plan, getting drug coverage, whatever it is, you call in, you're going to talk to someone that's right here in our office that you will have that you'll be able to communicate with them. You're not going to somewhere else across the world with a language barrier. You're going to be able to talk to someone that's trained by my dad. And it's just a great opportunity. We consider it an honor to help everybody that we get to help. And you don't pay us anything extra. We can't surcharge you for insurance. All of those insurance carriers that are filling up your mailbox, that are buying ads on TVs and hearing ads on the radio, we write for these carriers. And we're able to sit down and compare all of these options. I look at Advantage plans with people when they call in and type in their zip code, and there's 68 different options somebody had yesterday. How in the world do you decide between 68 different options? Well, we know how. And we figured out how to make this very, very simple. So if you need help, our services are free. We don't work for free. We're paid by the insurance companies, but we don't cost you anything extra. And our value, I truly believe what you can expect to get from us is not only are we going to help you sign up for your plan, but you're also assigned a dedicated client care manager, we call them. And this is somebody that if you move, if you have a billings issue, if you have a claims issue, if you lose your ID cards, whatever it is, we are here to help you, not only at the beginning, but also for life. And it's the way we've set up our company. It's the way we've tried to do business for the last 15 years. You can look at us on Trustpilot, Facebook, Google. We've got thousands and thousands of 5-star reviews, and we would love to help you. So if you would like help with that, you can call in, schedule an appointment with someone from our office. Doesn't matter where in the country you live. We're able to help you in all 50 states. The phone number is 800-782-6676, 800-782-6676. We'd consider it an honor and a privilege to help you. So on Monday, we'll be back. We're going to be talking about why your first 2 years of retirement are your biggest risk. We're bringing one of the guys that works at our company, the gentleman who leads our financial planning division. We're going to bring him and just have him share with you guys a little bit of why the first couple years of retirement are the biggest, riskier years that you don't want to mess up. So make sure you join us. We'll be back here Monday at 11 a.m. Central Time to noon, just like we're here every day, 11 to Central Time, taking your questions, sharing just a little bit of what we know so that you all can do Medicare just a little bit better.